Hello, I'm Renzo Ginto, a physician from the Philippines, and I'm thrilled to be giving this lecture to you about climate change and climate-related disasters and their implications for public health. First, let's review what climate change is. We know that planet Earth has a natural greenhouse effect. And when we emit greenhouse gases into the atmosphere, carbon dioxide and others, these exacerbates or worsens this greenhouse effect. And what happens is that there's less heat that escapes into the space and more heat that is re-emitted back to the planet's surface. And that leads to, first, the continuous warming of the planet, but also in turn, it generates a lot of different impacts and consequences in different parts of the world. And these are the major sources of greenhouse gas emissions, as you can see in these pie charts. Electricity production, especially through the burning of fossil fuels, is a major source of greenhouse gas emissions. But also the industry, our transport systems, the way we dispose our waste, the land use change that we are seeing in many parts of the world, agricultural production, food production, all of these sectors are emitting enormous amounts of greenhouse gases, which again worsens or exacerbates the greenhouse effect that I just described to you a while ago. And when climate change continues to worsen and be aggravated, here you are seeing the different effects, the different consequences in many different ecosystems. So in the Pacific, for instance, or in the Caribbean, we expect stronger typhoons, stronger storms. In places like Australia, we are now already seeing more wildfires. In Africa, more droughts, increasing temperature, and many other effects, including in the oceans, damaging of the corals through their bleaching because of the warming of the water. So there's so many different impacts in many different parts of the world, all connected to the climate crisis. And of course, when these environmental changes or phenomena do occur, there are a wide range of social and economic impacts to people, to human lives. So here you will see that, work productivity can be affected as we get exposed to increasing temperature. Food harvest will also shrink, and the productivity of our land, of our farmlands, again, because of either increasing temperature or precipitation, or even extreme weather events such as typhoons and intense flooding. Water supply is also anticipated to decrease. And we know that water is so essential to human survival. So these are just some examples of the social and economic impacts that we can anticipate as climate change worsens in the years and decades to come. And that is why we as a society need to do two things. And maybe you've heard of these. These are terms that are oftentimes used in climate change discussions. We need first to mitigation. And that means we need to reduce our greenhouse gas emissions, the ones that I talked to you about a while ago, so that we can prevent the further worsening of climate change, the further increase in global average temperature. On the other hand, unfortunately, climate change is already happening in many parts of the world, including in my home country, the Philippines. And that is why we need to put in place adaptation measures so that we can respond to the consequences of climate change, to agriculture, to our living conditions, but also including to our own health as well. And the sad thing is that as climate change continues to worsen and to happen, the time that we have in order to prevent the worst from happening is really shrinking. As you can see in these headlines, 5% chance of reaching the Paris Agreement goals. We know that the Paris Agreement gave us a deadline, which is 2030, to make sure that we don't exceed the 2 degrees Celsius or even 1.5 degrees Celsius allowable global temperature increase. So all of these are definitely worrisome, should be a cause of concern to the larger society in general, but also to us in public health. And here in this graph, you will see, these are the latest numbers, you will see that the commitments of countries are not adequate for us to achieve the Paris Agreement goals. You will see that the current policies that we have today can bring us to a world that is 2.7 to 3.1 degrees Celsius warmer than today by 2100. And that can already, as I already discussed to you a while ago, that will bring us a lot of catastrophic impacts to human health, to our societies, to our human communities at large. And during the time of the COVID pandemic, you probably have seen in the news reports that, oh, the skies have become, bluer, and the air has become more breathable because of the reduction in emissions. Coal-fired power plants have been shut down temporarily during the initial part of the pandemic when the lockdowns have been imposed in many parts of the world, including in China. But the reality is, as countries and communities begin to reopen, as lockdowns related to the COVID-19 pandemic are beginning to be lifted, the emissions, greenhouse gas emissions, are just surging back. They're returning to their old 2020 pre-pandemic levels. And this shows to you that a pandemic response, such as what we're having now, the lockdowns, the temporary restrictions, are not an effective way to decarbonize society and to prevent the further exacerbation of the climate crisis. So we really need to come up with more sustainable and more equitable and healthier solutions as opposed to pandemic-related lockdown. And this is the sad story also. When COVID-19 showed up at our doorstep, it didn't mean that climate change disappeared. In fact, climate change is continuing to happen, as I already mentioned to you a while ago. And these are just some of the extreme weather events that we can anticipate and that we already saw while we are fighting a global pandemic, fighting an unseen coronavirus. We've seen the typhoons in the Philippines, here in my home country last year, but also the wildfires in Australia, but also in California, the increasing heat, the heat waves in Canada, for instance, and also the intense flooding that we've seen in Germany in the past few weeks. And so climate change is really an issue for us in the health sector. We should embrace it as our issue and as our mission to address it. In the LANCET in 2009, they published that climate change is the biggest global health threat of the 21st century. And a few years later, they also described tackling climate change as the greatest global health opportunity of the 21st century. And so we have a great opportunity here to improve the health of human populations, even during the time of a pandemic, by addressing climate change, reducing our greenhouse gas emissions, and also preparing our societies for the inevitable health consequences that, again, we're already seeing in many parts of the world. So this graph is from the LANCET, published in 2015, and it just shows to you the many different pathways by which climate change leads to health impacts. And the main summary from this slide is that there are multiple pathways that link climate change to human health, whether through storms or drought or intense flooding or the heat waves, the effects that I mentioned to you already a while ago. And all of these will lead to a wide range of health impacts. As you can see, there is no disease group that is immune to climate change, whether they're infectious diseases that are sensitive to the changing climate, mosquito-borne diseases, water-borne diseases. Undernutrition is expected to worsen. The Lancet actually once reported that we can anticipate reversal of 50 years worth of gains in global nutrition if climate change will not be averted. But also non-communicable diseases, cardiovascular disease, respiratory diseases that are worsened because of air pollution. We know that air pollution, especially in cities, is also produced by the same sources of greenhouse gas emitters, the fossil fuel industry, our transport systems, etc. And there's also growing evidence that mental health is becoming affected as well by climate change. So all of these effects I will be talking about in greater detail in the coming slides. And so I actually want to invite you to visit this website of the New England Journal of Medicine. As you can see here, climate change is going to affect every organ system of the human body. And this is a very interactive website which will educate you about the links between climate change and the different specialties in medicine, whether it's cardiovascular health or dermatology, infectious diseases, nutrition, etc. So again, visit this website. In 2014, WHO came up with some estimates of how climate change is going to affect the health of the global population. These are definitely conservative estimates or a gross underestimate, because it's really hard to quantify how much disease and even death will be generated by climate change in the coming years and decades to come. But as you can see here, from 2030 to 2050 alone, we can anticipate an annual, 250,000 deaths, and some of them will come from heat-related illnesses, diarrhea or waterborne diseases, malaria and other mosquito-borne diseases, and of course, malnutrition. And of course, again, as I've mentioned, there are many other diseases that are hard to quantify and they're not included in this number. So we can anticipate much bigger numbers or numbers of death related to climate change in the years and decades to come. And this is the other sad and concerning story about climate change and its links to human health, that the health impacts will be unfairly distributed. This is an old slide from the World Health Organization, which I think still rings true until today. At the top, you will see the map of the world. The countries and regions that are being magnified are the ones that have emitted the greatest amount of greenhouse gases to the atmosphere. On the other hand, at the bottom, you will see the parts of the world that will be suffering the consequences, specifically the health consequences of climate change. They will be the ones bearing the brunt. And as you can see, that the countries at the top and the countries at the bottom are not the same. The countries that have emitted the greatest amount of greenhouse gases are high-income countries in North America, Europe, and much more recently, China as a leading emitter. And at the bottom, you will see the parts of the world that will be suffering are Africa, parts of Asia, South Asia in particular. And I always say that the Pacific Islands are already too small to be magnified in this map, if not totally erased from the face of the earth due to sea level rise, which is already happening and that will continue to worsen in the coming years and decades. And so, climate change and health are at the very core a health justice issue, an issue of equity, and we need to make sure that the vulnerable and the marginalized are being protected from the health impacts of climate change. So this is the part of the world where I'm from, Southeast Asia, which is very close to Australia. And as you can see in this map, the redder the country is, the more vulnerable the country is to climate change. And unfortunately, my country, the Philippines, is the reddest of them all. So it just shows to you how vulnerable the Philippines is to climate change and its myriad consequences. And indeed, in the Philippines, we are very familiar with typhoons, hurricanes. If you're in North America and the Caribbean, and these typhoons emanate from the Western Pacific. Annually, we are visited by around 20 typhoons, and now we're seeing the number increase, but also the intensity increasing as well. And these are some of the images that you can anticipate to see when a typhoon, an extreme weather event such as a typhoon, does happen. Your livelihood, your infrastructure, your schools are all being destroyed, but also hospitals and health professionals are affected. And of course, there are a wide range of diseases and even death that happen when these calamities strike. And as I've said a while ago, during the pandemic, the Philippines has experienced all these, calamities, these extreme weather events related to climate change. And the Filipinos, especially the poor and the marginalized, have been confronted with a dilemma. On one hand, do I stay in the house, protect myself from COVID, while my house is being inundated by intense flooding, or maybe the roof is blown away by the strong wind? Or on the other hand, do I move to these cramped evacuation centers, temporary shelters, to protect myself from climate change and these extreme weather events? But in exchange, I am definitely highly susceptible to getting the unseen coronavirus, because as you can see in the photo, there is no social distancing to begin with in these kinds of places. And so, this dilemma is very real. And in the Philippines alone, we've seen the confluence between the COVID crisis and the climate crisis. I already mentioned to you what happened in Germany. And, before, we always think of these floodings and typhoons as only happening in low and middle income countries like the Philippines, or in countries in Africa, for instance. But more recently, we've seen even high income Western countries like Germany are already experiencing these calamities, these extreme weather events. And so this just shows to us that really no country, no part of the world is immune to climate change. All of us are facing different kinds of vulnerabilities, and we need to get our acts together to address this global challenge. I already mentioned to you a while ago that climate change is also providing the conditions, the breeding ground for the reemergence of old and existing infectious diseases, but also the emergence of new ones. And who knows, maybe COVID-19 and the future pandemics that we can anticipate are all related to the intensifying climate crisis. There is even some hypothesis that the recent outbreaks that we've seen over the past decade, such as the Ebola crisis in West Africa, have some links with the climate crisis as well. And for instance, dengue, which is a mosquito-borne disease that you can find in the tropics, is already found in temperate regions of the world, for instance, in Europe. And again, it is being hypothesized that climate change has something to do with the migration and the expansion of these infectious diseases to places where they used to be not existing for decades or even centuries. And here in Asia, it's also expected that the average temperature is going to increase in the coming years and decades. And therefore, heat-related illnesses will be anticipated to increase as well. And so we really need to establish health systems that are ready to address, for instance, increasing emergency consults because of heat stroke and other heat-related illnesses, especially when heat waves do occur in many places. And as I mentioned already a while ago, in Canada, especially during the past few weeks, there have been hundreds of deaths that have happened, again, because of the heat waves, the increasing temperature. And so heat-related illness should now become a very important public health concern for many parts of the world, both those in the temperate regions, but also here in the tropics as well. Of course, as I've said a while ago, climate change is also going to jeopardize our ability to provide food because of crop failures that can lead to food insecurity, declining harvest in farmlands. And so we need to start looking at food and nutrition, and how can we can make sure that our farmlands are resilient, our food systems are able to feed populations in the years to come while climate change is exacerbating. And not only in terrestrial food systems should we incorporate climate change considerations, but also in our fisheries. So for instance, the Philippines, as an archipelago of more than 7,000 islands, surrounded by a lot of water, fisheries are certainly an important sector, part of our food sector, and therefore we need to make sure that we are still able to catch, fish and other marine food products to sustain the health and nutrition of our communities, especially those living in the coastlines. We also know that the food system that we have now is not just creating, undernutrition or resulting in undernutrition because of the unfair and uneven distribution of food supply, but also obesity. We know that our food products are also which are high in calories and high in fats, are contributing to this other epidemic. And the same food system is also emitting a lot of greenhouse gases into the atmosphere, using up a lot of land, water, and energy, and therefore contributing to the climate crisis. And so if we are going to address the syndemic, this triple crisis of obesity, undernutrition, and climate change, we really need to make some huge reforms in our global and even local food systems. Another health issue related to climate change is air pollution. And we know that, as I've said a while ago, that the sources of air pollution are also the same sources of greenhouse gas emissions. And so we really need to address these root causes, the energy systems, our transport systems, deforestation, for instance, our food systems that also emit greenhouse gases, and particulate matter that lead to air pollution. And so all of these will need to be addressed. And addressing these will lead to a dual benefit of reducing climate change, but also reducing the level of air pollution, especially in our cities. And that will be very good for our lungs and our hearts. Because, air pollution, as being described here, is an invisible killer. It leads to lung cancer, to heart disease, to other lung diseases. And so we really need to address air pollution. And while doing that, we are able to also address climate change, which, as I've already described to you a while ago, has its own range of health effects. And another form of air pollution, which can, jeopardize our lungs and our respiratory and cardiovascular health, is the bushfires or the wildfires that we're already seeing in places like your country, Australia, but also in North America. And these wildfires happen because of the increasing dryness, in forests, there's an increased likelihood of these fires to be happening in those conditions, again, because of climate change. And so we need to address climate change so that we can prevent, these bushfires and wildfires, which is another source of air pollution, in addition to other health impacts, such as, forced displacement of families living near these, ecosystems. So again, another serious health emergency that we need to address, especially in places like Australia and North America. And as I mentioned a while ago, climate change is also affecting mental health as well. There's a growing evidence or body of knowledge about how climate change is affecting the health of our brains and our hearts. And, climate change affects mental health in at least two major ways. One is through the abrupt extreme weather events, such as typhoons and flooding that I mentioned to you a while ago. When these climate-related calamities do happen, families are forcibly displaced, They experience a lot of trauma, especially the children, and this can lead to post-traumatic stress disorder and other forms of mental health sequelae. On the other hand, climate change is also affecting our communities in a more subtle, slow onset way, such as, again, through intense heating, increasing in temperature, food insecurity. And all of these will bring about different forms of slow and subtle mental health consequences, such as the newly coined terms like eco-anxiety or ecological grief. And these are long-term effects of climate change on mental health that we also need to be preparing for and addressing. And so climate change and mental health, again, another growing area of inquiry, and we should act on the climate in order to protect the mental health of our populations. And then here you will see that, especially in places like the Philippines, where you have lots of coastal communities, as I've said, we are an archipelagic country. We are also anticipating the increasing level of the sea, and sea level rise resulting from the melting of the ice caps, the warming of the ocean, can lead to the intrusion of seawater into freshwater systems, and that can increase the salinity of drinking water. And there's already growing evidence in many parts of the world that increasing salinization of drinking water can also lead to a wide range of health impacts, increasing hypertension, preeclampsia among pregnant mothers, and miscarriage as well, infant and neonatal mortality, and other effects on the urinary system, the kidneys. So these are new issues that are already being seen in many parts of the world where sea level rise is already happening. This is another way of illustrating the health impacts of sea level rise and increasing salinity of drinking water, which I already mentioned to you a while ago. And of course, it's not just the salinization of drinking water that we should be concerned about. It's also about the inundation and the flooding of entire communities, entire cities. And here in one study, as you can see, a lot of the major cities in Asia are at risk for sea level rise and coastal flooding. Bangkok, Jakarta, Bangladesh, and of course, even the islands in the Pacific are not just susceptible to flooding, they can totally disappear because they are small, and there's a higher likelihood that their entire islands will be covered by water. And so in the coming years, and it's already happening now as we speak, we can anticipate a huge exodus or movement of people living in these islands, living in the coastlines, who will need a new place to inhabit. And one term that has been introduced is the word or the phrase climate change refugee, although the word refugee has its different connotations in international law. And so climate-induced migration or forced migration due to climate change is going to be another health crisis that we should all be addressing and preparing for in the coming years and decades. And this is interesting because it's not just the human body, our diseases that are being affected by climate change. It's also our responses to these challenges. And so here you will see that there's also growing research about the effects of climate change on our pharmaceuticals, the medicines that we take. And, of course, we can anticipate increased use of these medicines, especially for climate sensitive conditions. But also the stability of these medicines can be compromised by increasing temperatures, increasing humidity, the ability of our bodies to process these medicines can also change. Again, changing body physiology. So these are new arenas for research as well, this nexus of climate change and pharmaceutical use. So I already talked about a wide range of health impacts, to diseases, to pharmaceuticals, to our bodies, to public health. of climate change. And now the question is, are we ready to build health systems that consider the climate? Because, as we've seen during the pandemic, our healthcare systems are not prepared for crisis. We are in a state of shock. And if we are not ready for a pandemic, it's highly likely that we're also not prepared for long-term climate change, especially the effects that I just described to you a while ago. And so what we need in the 21st century are health systems that are not just universal, that are not just accessible to everybody, not just high value, meaning people leave the hospital and the healthcare facility not just healthier, but happier. What we need are health systems that are climate smart. And climate smart is the convergence of mitigation, which is the reduction of greenhouse gases, and adaptation, which is the ability to respond to the health consequences. Remember, I mentioned to you a while ago the difference between mitigation and adaptation. And the health systems, public health, should be both mitigating climate change and also adapting to the inevitable health consequences. So that is what climate smart means. And of course, because we are now living in the middle of a pandemic, we also need to assert that our health system should be pandemic resistant or pandemic ready as well. And so I mentioned to you the word climate smart a while ago. The World Bank in 2018 came up with this report, Climate Smart Healthcare. Again, the convergence of mitigation or sustainability and adaptation or resilience. And you will see in this Venn diagram that there are so many things that healthcare systems can do in order to both mitigate climate change, but also adapt to climate change. And we will go into detail shortly in the next slides. So here you will see that, for instance, in the US, it's estimated that around 10% of greenhouse gas emissions are coming from the health sector. Another global report estimated that around 4.4% of the total greenhouse gas emissions of the world is actually coming from the health sector, the global health sector. And so we, health professionals, our health systems, our hospitals should be also reducing our own emissions as well. And as you can see in this diagram, there are many parts of the health sector that are emitting greenhouse gases. And in fact, there are 3 types of greenhouse gas emission sources within healthcare. We call them the scope 1, which are the on-site sources. If you have your own energy plant or electricity production facility in your health facility or your hospital, then that is what you call a scope 1 emission. If you get it from elsewhere, like a coal-fired power plant, you're getting electricity from the grid, that is what you call a scope 2 emission. And that should also be counted when we are accounting for our greenhouse gas emissions. And the third one is scope 3 travel. So it's not related to electricity, but it's related to our many different activities. When we purchase our pharmaceuticals, we should be counting the emissions from long distance transport and even manufacturing into our own emissions accounting. The waste disposal, our travel, both for patients and providers alike. The food that is being produced that we serve to our patients and staff in our hospital. So all of these are what you call scope 3 emissions. And again, if we want to reduce our emissions within healthcare, we need to reduce not just our scope 1 and scope 2, but also our scope 3 emissions as well. Here is another report showing to you the breakdown of the different types of emissions within healthcare. Again, most is coming from our electricity consumption, but we also emit other forms of emissions, again, through the food that we serve, the transport of patients and providers, the pharmaceuticals that we purchase and that we provide to our patients, and when we treat and manage and dispose our waste. And unfortunately, during the COVID-19 pandemic, we are seeing a lot of these, new forms of pollution that not only, create environmental pollution in our soil, in the water, in the air, but also contribute to the climate crisis And that's why this is the right time to think about how can we reduce our greenhouse gas emissions while addressing the current pandemic. So there are many frameworks that exist that guide us on how we can do it within our sector. And one of which is this 10-point agenda of the global green and healthy hospitals that is initiated and powered by Healthcare Without Harm. So I invite you to visit their website. And as you can see, we can do so many things in the way we manage our chemicals in the hospitals, the way we design our buildings. We have to ensure that we are abiding by, green building design, natural ventilation and lighting. Again, the food that we provide, the pharmaceuticals that we purchase, etc. So there are many things that we can do to reduce our greenhouse gas emissions within our sector and within even our facility alone. And this is another report that I had the privilege of co-authoring. We were able to, project how much emissions can we reduce within our sector, and what is the game plan for decarbonizing our sector. And there are at least 7 main things main high impact actions that we can make in order to contribute to climate mitigation. Again, shifting to renewable energy, zero emissions buildings, improving our transport systems, our provision of food to our patients and staff, and many other interventions. And this is what we're calling green universal health coverage. We cannot achieve universal health coverage without incorporating green climate smart measures so that we are not contributing to the climate crisis and reducing our own emissions. And in addition to reducing the emissions of our sector, we know that the emissions from other sectors will need to be decreased as well. And that is why it's important for the health sector to engage with these other sectors, the energy sector, the transport sector, the food sector, and the different industries. And we need to highlight the health co-benefits of mitigation in these different sectors. If we address the energy system, it's not only that we will be reducing climate change, but also producing cleaner air, which will be good for the health of our communities. If we are able to change our food systems and make them more low carbon, we will also reap a lot of benefits to global nutrition as well. And so we need to highlight the health co-benefits of mitigating in other sectors. What's good for the climate is also good for the planet as well. So I just described to you what is our role as a health sector in terms of climate mitigation. Now I'm shifting gears and we will talk about our role in terms of climate adaptation or resilience building. And here you will see in this diagram published in a WHO report that what we want is a health system that is able to not just recover, but transform amidst climate-related shocks and stresses. For instance, extreme weather events like typhoons and flooding, or increasing temperatures or sea level rise. We want our health systems, health facilities, hospitals to be bending but not breaking. We want them to be the last hospital or the last building standing in the face of extreme weather events and other climate-related phenomena. And so part of resilience building is to make sure that we are prepared to address these disasters. And here you will see the disaster cycle. We need to be prepared. We need to be able to reduce the risks and mitigate the risks. And we should also be able to respond if these extreme weather events do happen. And then, of course, we need to have the investments and the capacities to be able to reconstruct and recover. So a very similar cycle that we need also for the ongoing COVID-19 response. And we also need our health systems to be climate resilient, not just in terms of our ability to respond to these disasters, but the whole health system in general will need to be climate resilient. And I invite you to visit this document or to access this document from the WHO, an operational framework for building climate resilient health systems. And what they did, what WHO did, is they laid out climate resilient measures that need to be done and incorporated into the different building blocks of the health system, the leadership and governance. The health workforce should be climate ready. The information systems, bringing together climate data and health data so that we can better project our health needs in the face of a warming planet. Our service delivery systems, primary care, for instance, should be climate resilient and climate ready. Do we have the right financing and the adequate financing so that we can invest in these climate resilient measures? So again, every aspect, every building block of the health system should also be climate resilient as well. And even at the health facility level, we should be able to incorporate both climate resilience and environmental sustainability, making sure that our health facilities are not emitting carbon, not contributing to different kinds of pollution. And I invite you to also look into this document, a very new report published by the WHO on how we can incorporate, again, climate resilience and environmental sustainability in our health facilities, in the workforce, in the way we manage our waste, and also resources such as water and energy, and also design our infrastructure and manage the different technologies that we use, our devices, for instance. And I already mentioned to you a while ago that primary care should also be in the front lines, and it will be in the front lines of climate action, because we know that primary care is the first level of contact in the community. And as you can see in this diagram, primary care can also play major roles in both mitigation and in adapting to climate change, which I already mentioned to you a while ago. So climate action, climate mitigation, and climate adaptation can be done at all levels, at the international level in the WHO, at the national level in the ministries of health, at the health system level, which I already shared with you a while ago, and also at the primary care level for general practitioners and all the members of the health team, again, at the local community level. And right now, there are so many actions happening around the world, especially in Asia, in terms of preparing our cities, our countries to climate change and its myriad consequences, including the health effects. So, efforts in Singapore, efforts in low and middle income countries like Bangladesh, and in many other parts of the world, in the Philippines included. And so what we need to happen, or what we need to do, is for the health sector to be part of these climate mitigation and adaptation efforts, because as I've mentioned to you already in this talk, health is a very important part of the climate discussion. Climate change is a health issue, and climate change is going to affect health in many different ways. And so I'm nearing the end of my talk, and first, I just want to remind us all about this, very popular and important graph during this time of the COVID-19 pandemic. We need to flatten the curve of COVID-19. We need to make sure that our health system's capacity is increased by adding more beds, recruiting more nurses, and today rolling out more vaccines. And I think that the same mantra, the mantra of flattening the curve, should be adopted in our response to climate change and its health effects. We need to flatten the curve of our ecological footprint, of our carbon emissions. But unfortunately, the main difference between the previous curve and this curve is that, unlike the healthcare system's capacity, the Earth's capacity is constant, it's unchangeable, and therefore non-negotiable. We can't add more beds. We can't, recruit more nurses or other health professionals. And so the only option that we have is to flatten our curve, to bend our curve, our flatten our emissions, and to really address climate change sooner rather than later. Because if we don't get our acts together, and I know right now we're all concerned about the first wave, the second wave, the third wave of COVID, we should also be equally, if not more, concerned about the future, not just waves, but tsunamis of climate related health consequences that we can anticipate again if we don't address climate change now. And that is why I invite all of you to embrace this new powerful concept, paradigm, field of planetary health. You should be familiar with the term public health, and public health is really about the health of people. And of course, there's no doubt that public health has really improved people's lives, added 25 to 30 years to the average life expectancy of the world for the past century. But unfortunately, we've improved public health oftentimes at the expense of the planet, putting food on the table without thinking about the environmental, the ecological impacts of our food systems, improving socio-economic opportunities in cities, but again, not thinking about the pollution that urbanization has created and inflicted on the air, soil, and water. And so planetary health, which is the convergence of the health of people and the health of the planet, should now be our framework, our unifying framework in this century, in this age of COVID-19 and climate change. Because now we have two patients. It's not just anymore our people, but also the planet as well. And so we need an integrated approach that advances the health of both people and the planet. Because we owe it to these children. We owe it to the next generation, the future children who are yet to come. And we need to make sure that we will be able to leave behind a healthy planet so that these children of the future can live healthy and equitable lives. So that's it. That is the connection between climate change and health. We've talked about climate-related disasters as well that we're already seeing in many parts of the world. But also more importantly, we've talked about the solutions, the actions, what we can do as a health sector, both to mitigate climate change, reduce our own greenhouse gas emissions, and also help other sectors to reduce their emissions to reap the health co-benefits, but also actions that we can do within the health sector so we can prepare for the health consequences and we can truly respond to the health needs of the people in the era of a warming planet. So again, thank you for listening, and together let's advance the health of people and planet. Stay safe.